My name is Vanessa Macias Alvarado. I am topic about Gigantism and Acromegaly due to Xq26 microduplication. Definition: clinically relevant pituitary adenoma have a prevalence of about 1 per dozen in the general population and are an important cause of morbidity due to the combined impact of hormonal dysfunction and tumoral mass effect. About 5% of cases occur in a inherited or familial setting.
Welcome everyone. We are nursing students from Al University and we want to talk about acromegaly and gigantism. So, what is acromegaly and gigantism? Gigantism and acromegaly occur when the pituitary gland makes too much growth hormone due to a tumor in the gland. So, first of all, what is the pituitary gland? Pituitary gland is the major endocrine gland, a bee-sized body attached to the base of the brain that is important in controlling growth and development and the functioning of the other endocrine glands. Acromegaly is a hormonal disorder that develops when your pituitary gland produces too much growth hormone during adulthood. When this happens, your bones increase in size, including those of your hands, feet, and face. The increased level of growth hormone can affect many systems in the body, including the cardiac and musculoskeletal system. Individuals with acromegaly may experience changes in their appearance as well, including increased spacing between teeth and enlargement of the facial features, feet, and hands. The metabolism can also change. Treatment focuses on lowering your production of growth hormone as well as reducing the negative effect of the tumor on the pituitary gland and surrounding tissue. Gigantism. Gigantism is a rare condition that causes abnormal growth in children. This change is most notable in terms of height, but girth is affected as well. It occurs when your child's pituitary gland make too much growth hormone, which is also known as somatotropin. What causes gigantism? A pituitary gland tumor is almost always the cause of gigantism. When a tumor grows on the pituitary gland, the gland makes far more growth hormone than the body. If your child has gigantism, you may notice that they are much larger than other children of the same age, and you will notice that may very large hand and feet, thick toes and fingers, a permanent jaw and forehead, coarse facial features. Treatment for gigantism aim to stop or lower your child production of growth hormone, and there is another option for treatment. This option is surgery, removing the tumor. The surgeon will reach the tumor by making an incision in your child's nose. The difference between acromegaly and gigantism is that acromegaly occurs in adults, typically between the ages of 30 and 50. Thank you for your listening.
Application in medicine. Alternative pituitary adenoma can occur alone in a family setting as part of familial isolated pituitary adenoma. Up to 20% of FIPA kindreds have germinal mutation of the aryl hydrocarbon receptor interacting protein. Rare cases of FIPA can also be caused by Xq26.3 microduplication that include the gene GPR101. Mutation lead to pituitary adenoma that have a distinctive clinical profile with a significantly younger onset, more aggressive tumor growth.
Today's topic is gigantism. Gigantism is a rare condition characterized by exaggerated bone growth and an abnormal increase in height, significantly above average. This condition occurs in childhood before the fusion of the bone's growth plate, which is usually seen at some point after puberty. The growth plate is the area of active, soft-growing tissues near the ends of the long bones in children and adolescents. Adults do not have growth plates. Most long bones have two growth plates, one at each end. They are found in many places, including the thigh, hand, and forearm. During adolescence, when growth is complete, the growth plates harden into solid bones. This happens around age 13 to 15 in girls and age 15 to 17 in boys. For people with gigantism, there is excessive growth during childhood before the growth plate closes or hardens. Gigantism should not be confused with acromegaly, the adult form of the condition, marked by an increase in bone size, including those of the hand, feet, and face. Causes. The most common cause of gigantism is a benign pituitary gland tumor. The pituitary gland is a small gland located at the base of the brain behind the bridge of the nose. The pituitary gland makes the hormones that control so many functions in the body, including growth, metabolism, temperature, urine production, and sexual development. A tumor on the pituitary gland causes it to produce excess growth hormone than the body needs. This subsequently leads to abnormal growth of soft tissues and skeleton. Other less common causes of gigantism include neurofibromatosis, an inherited disorder that causes tumors in the nervous system; multiple endocrine neoplasia type 1, or MEN-1, an inherited condition that causes tumors in the pituitary gland, pancreas, or parathyroid gland; Carney complex, that causes gland abnormalities as well as an abnormal growth in bone tissues; McCune-Albright syndrome, a genetic disease that affects the bone and skin pigmentation. Symptoms. Symptoms depend on the size of the tumor and may include tall stature, mild to moderate obesity, exaggerated growth of feet and hand, coarse facial features, thick toes and fingers, headaches, which may be severe or recurrent, visual changes, an irregular menstrual period in girls, deafness, weakness, delayed puberty in both boys and girls, nausea, excessive sweating. Diagnosis and treatment. If gigantism is suspected, the doctor may carry out a blood test to measure the level of growth hormones and insulin growth factor, or IGF-1, produced by the liver. Elevated levels of these hormones suggest gigantism. An oral glucose test may also be recommended. During this test, the child's blood levels of growth hormone are measured before and after taking a special beverage containing glucose. Normally, the ingestion of glucose reduces the growth hormone levels. In gigantism, the level will tend to remain the same, indicating that the body is producing too much growth hormone. If gigantism is diagnosed, imaging tests such as MRI scan of the pituitary gland will be carried out to find the tumor, its size, and location. Treatment. The goal of treatment is to lower or stop the production of the growth hormone and reduce the negative effects of the tumor on the pituitary gland and tissues around it. Treatment options include surgery to extract or remove the pituitary tumor, medications including octreotide or lanreotide, usually given as an injection, dopamine agonists such as cabergoline and bromocriptine, which are given in pill form, and growth hormone antagonists including pegvisomant, radiation to destroy tumor cell and reduce the growth hormone levels. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.
Pros and cons. Some may grow is orchestrated by a complex hormonal crosstalk involving the hypothalamus, pituitary, and peripheral tissues. One genetic disorder that affects this network can lead to increased secretion of growth hormone, which results in acromegaly. Is the excess in the in growth hormone occurs before epiphyseal fusion. The result can be gigantism. Non-syndromic gigantism is most frequently caused by pituitary adenomas.
Acromegaly is actually quite a rare disease, occurring about 3.5 patients per million per year, and it's caused by growth hormone production by a pituitary tumor. The symptoms of acromegaly can be subtle and very slow in onset, and those include changes in the sizes of your hands and your feet, as well as facial features, which include enlargement of the nose, protrusion of the jaw, something we call frontal bossing, which is enlargement of the brow bone. The issues with acromegaly are that the disease oftentimes comes on slowly over a period of years. So even though we can normalize the hormone in the long haul, some of the symptoms and signs of acromegaly are not reversible, including the bony changes that occur. In addition to the changes in the bony features, acromegaly can also be associated with fatigue, hypertension, diabetes, oftentimes induces joint pain, can sometimes cause sleep apnea, and carpal tunnel symptoms. Acromegaly is classically treated with surgery. That is the first-line treatment for the disease. If the tumor is less than a centimeter by a centimeter in size, the cure rate with surgery approaches 80 to 90%. However, if the tumor is larger than a centimeter by a centimeter in size, the cure rate does fall and sometimes approaches around the range of 50%. Clearly, having an expertise of a good neurosurgeon is critical in the treatment of this disease. If we do not achieve a surgical cure with acromegaly, what are the options for treatment? Well, those include medications which can help to control the levels, and in addition to that, radiation therapy with cyberknife and gamma knife therapy, which is an exquisitely pinpoint treatment for brain tumors and pituitary tumors alike. The advantage of using CyberKnife or Gamma Knife therapy is really a bullet-like approach to the tumor and sparing the rest of the brain tissue from radiation effect. Unfortunately, because the pituitary gland is such a small gland, when we are targeting the pituitary gland in the sense of the tumor that lies within it, we can sometimes knock out pituitary function. So anyone who has radiation therapy, Gamma Knife or CyberKnife, to the pituitary gland does have follow-up with us long-term to assure that their pituitary function remains normal. And in addition to that, if indeed the tumor is close to the optic nerves, then radiation therapy is something that sometimes cannot be achieved without damaging the optic nerves.
Issue applied in Ecuador. Acromegaly is a consequence of chronic growth hormone excess, due in the majority of cases to GE secretion pituitary adenoma and occurring with a population prevalence of 60 per million and incidence of 3-4 per million per year. Male and female appear to the equally affected with
Growth hormone is pulsatile throughout the day and is not useful for the diagnosis of acromegaly. The best screening test is a serum IGF-1 or insulin-derived growth factor. Excess growth hormone is confirmed with an oral glucose tolerance test because glucose normally suppresses growth hormone levels to less than 1 nanogram per ml. Growth hormone levels greater than 1 nanogram per ml are diagnostic of growth hormone excess. Anterior pituitary MRI should be obtained once growth hormone excess is confirmed biochemically to rule out a pituitary lesion. Acromegaly is the clinical syndrome that occurs when a pituitary tumor secretes excessive amounts of growth hormone in an adult patient. Prior to puberty, patients with growth hormone secreting tumors develop excessive longitudinal growth and gigantism above normal for age. Large skull. There may be facial edema and coarsening of facial features, excessive spacing between the teeth, usually of the lower jaw, and finally macroglossia, or enlargement of the tongue. The skin can demonstrate thickening and skin tags, and the hands and feet may be disproportionately large. In the joints, arthritis may be a manifestation, and other internal features include diabetes mellitus, hypertension, colon polyps, and excessive perspiration or hyperhidrosis. Obstructive sleep apnea is usually caused by excessive growth of tissue in the upper airway and in and around the mouth, along with macroglossia, which leads to obstructive symptoms when sleeping. Left ventricular hypertrophy can occur in the heart, and these patients may present with cardiomyopathies. And then finally, there are increased rates of cancers, particularly of the colon, esophagus, and stomach, as well as thyroid and even melanomas. The clinical pearl here is in clinical practice, because of the increased number of colonic polyps, patients are predisposed to colon cancers and will often present as a first feature with blood in the stool. The treatment of acromegaly requires transsphenoidal tumor resection, and surgery is the only treatment that is potentially curative. Remission is achieved when IGF-1 levels are within the normal range for age, and the response of growth hormone to glucose tolerance test returns to normal. Patients not achieving remission require injectable somatostatin analogs to inhibit growth hormone secretion. High-dose dopamine agonist therapy is marginally effective when the tumor co-secretes prolactin. Pevisigmont, a growth hormone receptor blocker, is then used to lower IGF-1 levels, but it works in the peripheral tissues as an antagonist to growth hormone and does not decrease growth hormone production by the tumor.
Acromegaly is the clinical manifestation of excessive growth hormone. So let's talk about how the growth hormone is produced. Normally, the hypothalamus, which is at the base of the brain, secretes the growth hormone releasing hormone. The growth hormone releasing hormone then acts directly on somatotrophs of the anterior pituitary to induce transcription of the growth hormone gene and thereby to stimulate both synthesis and secretion of growth hormone. The main cause of acromegaly is a pituitary adenoma, which is a tumor of somatotroph cells in the anterior pituitary gland. These somatotroph cells continuously make excess growth hormone. More rarely, acromegaly can result from hypothalamic tumors that release too much growth hormone releasing hormone, or even tumors from other parts of the body that start producing the growth hormone ectopically, meaning that it comes from an unexpected location. When the pituitary gland releases the growth hormone into your bloodstream, it triggers your liver to produce a hormone called insulin-like growth factor 1. IGF-1 is what causes your bones and other tissues to grow. Too much growth hormone leads to too much IGF-1, which can cause acromegaly signs, symptoms, and complications. The symptoms of acromegaly, which can take years before they are recognized, include growth of the bones of the hands, feet, and lower jaw, and protrusion of the forehead, soft tissue swelling in hands, feet, face, and tongue, increased size of organs, and excessive sweating. The diagnosis of acromegaly can be made when there are elevated levels of insulin-like growth factor 1 and growth hormone. An MRI can help confirm the presence of the pituitary tumor. Treatment of acromegaly depends on the underlying cause. If there's a pituitary adenoma, then surgery can be done to try to remove the growth. And in cases where that doesn't work, radiation therapy can be used. Medications like somatostatin analogs can also be used to limit the growth hormone production. Alternatively, growth hormone receptor antagonists can be used to stop growth hormone from binding to target tissues.
Do not forget to like the video.
Conclusion. We describe a pediatric disorder that is caused by an Xq26.3 genomics duplication and is characterized by early onset gigantism resulting from an excess of growth hormone. Duplication of GPR101 provides